The smell hits the American surgeon before he even touches the bandages. It is sweet and wrong, the kind that tells a trained nose that tissue is dying. The girl on the table looks no older than 19. She wears a torn auxiliary uniform. Her hands shake so badly she grips the metal table to stay upright. In broken English, she whispers that she is fine, that the wounds are fine, that she only needs rest and food. When the surgeon begins unwrapping the fabric around her left forearm, it sticks. He pulls gently, she gasps. Her face drains of color. What lies beneath is more than an injury. It is an infection spreading so fast that without intervention, she will lose the arm by morning. We are in a forward American field hospital in Western Germany, April 1945. The war is nearly over, but casualties still flood in, German and American alike. The hospital is a converted factory with concrete floors, hanging lights, and rows of metal cots stretching into shadow. Nurses move quickly, boots echoing. The air smells of disinfectant and rust. 2 American military police officers bring in a young German woman captured 3 days earlier. She was taken near a collapsed supply depot outside a small town. She wears the grey-blue uniform of a Luftwaffe auxiliary, one of the women placed on anti-aircraft crews and communications as Germany ran out of men. Her shoulder is torn, her uniform caked in mud. Her left arm is wrapped in makeshift bandages, strips of fabric tied tightly with whatever was available. She does not resist. She does not speak. She walks where she is told and sits when directed. The surgeon assigned to her is Captain William Brenner, a 34-year-old from Pennsylvania. He has been in Europe since Normandy and has seen thousands of infected wounds. He knows the worst cases are often the quiet ones when the patient is too frightened to complain. When he approaches, she looks up with wide, frightened eyes and says in halting English, "I am fine, just tired." But Brenner has done this too long to believe that. No one is fine when their hands are shaking that violently. He asks her name. She hesitates, as if deciding whether it still matters. Greta Meyer. He asks when she was wounded. 5 days ago, maybe 6. She is not sure anymore. The retreat blurred the hours into one long stretch of fear. He asks who treated her. She shakes her head, no doctor. Another girl in her unit wrapped the arm with torn cloth and told her to keep walking. Stopping meant falling behind. Falling behind meant capture or worse. Brina nods once and reaches for the scissors. The moment the metal touches the bandages, Greta's composure breaks. Tears spill down her cheeks, as if she has been holding them back for days. The outer layer is torn wool, probably from a coat. Beneath it lies cotton fabric stiff with dried blood. Under that is gauze stained brown and yellow, hardened where fluid has seeped and dried. He works carefully, cutting through each layer and easing it away so he does not rip living skin. Greta turns her head toward the wall, breathing fast, her chest rising and falling in shallow bursts. When the final strip comes free, Brenner stills. The wound runs from her wrist halfway up her forearm, jagged and deep. The kind caused by metal fragments tearing through flesh at high speed. The cut itself is not what stops him, it is the swelling. The skin is stretched tight and shiny, red streaks climbing toward her elbow like veins of fire beneath the surface. In the center of the wound, thick greenish-white pus fills the cavity. When he presses lightly near the edge, heat radiates through his gloves. The infection is aggressive and advancing. He looks at her and speaks slowly, clearly. The infection is spreading. If we do not clean this now, it will reach your blood. Her lips tremble. Will you cut it off? She whispers. Brenner hesitates. He knows the truth would terrify her, break her spirit. Not if we move fast, he says instead. Then he calls for a nurse, pulls on gloves, and begins gathering instruments for debridement, the procedure that will decide if her arm survives. Lieutenant Sarah Hayes, a surgical nurse from Ohio, joins him. She takes one look at the wound and knows what is coming. Debridement means cutting away dead tissue, and for a wound this infected, it will go deep. There is no anesthesia for prisoners. Hayes sets a tray with scalpels, forceps, irrigation solution and sulfur powder. She brings a leather strap and, in German, tells Greta to bite down if the pain becomes unbearable. Greta takes it with both hands, trembling so violently she shakes the table. Outside, artillery rumbles, but inside, silence reigns except for the clink of metal instruments and Greta's shallow, rapid breathing. Brenner explains the procedure. Cut away dead tissue, flush with saline, pack with sulfur, rebandage. The outcome will determine if the arm survives. If the infection stops, she keeps her arm. If not, amputation within 24 hours is certain. He asks if she understands. She nods. He asks if she is ready. She does not answer. Brenner starts with irrigation, flushing pus and debris from the wound. Greta flinches but does not scream. He switches to the scalpel. The first cuts are shallow, trimming edges where necrosis has begun. Greta grips the table, knuckles white, biting the leather strap. Her body jerks with each incision, but she remains conscious. Hayes keeps her grounded with a hand on her shoulder. Deeper in the wound, infection pockets hide in the muscle. Brenner opens and drains each abscess, scraping out dead material. With each cut, Greta tenses, tears streaming down her face. Hayes instructs her to breathe slowly, reminding her she is not alone, her voice steady and calm. The procedure lasts 40 minutes. Brenner works quickly, hands steady. Blood wells up, which is a good sign. It shows the tissue is alive. Slowly, the grey-black necrotic tissue is replaced by healthy red flesh. The wound edges are raw but free of pus. He packs the cleaned wound with sulfur powder, layers on fresh gauze and rewraps tightly. Then he tells Greta, "You did it." The worst part is over. She does not respond. Pale, wet with tears, she stares at her bandaged arm, as if seeing it for the first time. Greta is moved to the recovery cot in the prisoner ward, behind a canvas curtain, guarded by a military police officer. 6 men lie nearby, all German soldiers with various injuries. None speak to her, and she remains silent, staring at the ceiling, her bandaged arm resting across her chest. Hayes checks on her every 2 hours, unwrapping the bandages and watching for swelling, heat, or new drainage. For the first 12 hours, the wound remains stable. The redness does not spread. The swelling holds. Late that night, everything changes. Greta develops a fever that rises quickly. By midnight, her skin is slick with sweat, and she is mumbling in German, half-conscious, her body trembling beneath thin blankets. Hayes wakes Brenner. He arrives in his undershirt, hair uncombed, eyes sharp with concern. He checks the wound. The bandages are clean, but the skin feels warm again. The red streaks that had faded are darker now and longer. This is not the original surface infection. Something has entered her bloodstream and is moving faster than the sulfur can stop it. Brenner faces a decision. If the infection is in her blood, the only certain measure is amputation. Remove the arm, remove the source. Hope it is not already too late. But there is no guarantee amputation will save her, and if he is wrong, he will have taken her arm for nothing. If he waits and does nothing, she could be dead within days. He asks Hayes what she thinks. She looks at Greta, barely conscious, and answers quietly, "If it were my arm, I would want you to try everything else first." So Brenner tries everything. He starts intravenous fluids to keep her hydrated and flush her system. He increases the sulfur dosage and repacks the wound carefully. Her arm is elevated to reduce swelling. He checks her pulse, temperature and wound every hour. The fever remains high. The infection does not retreat. For 6 long hours nothing changes. Greta drifts in and out of consciousness, whispering her mother's name, sometimes crying without sound, as the night stretches toward dawn. Just before dawn, something shifts. Greta's fever breaks suddenly. Her temperature drops 2 degrees within an hour, and the tension in her body eases as if a storm has passed. By sunrise, she's awake, weak but aware, asking for water. Brenner unwraps the bandages with careful hands, studying the wound in the pale morning light. The redness has stopped spreading. The skin feels cooler. The swelling has reduced. The infection has not vanished, but it is no longer advancing toward her blood. Greta is going to keep her arm. When Brenner tells her, she does not smile. She closes her eyes and whispers, "I thought I was going to die." Over the next 3 days, she recovers slowly. The fever does not return. The wound begins healing from the inside outward, clean and controlled. She is still weak and in pain, but she can sit upright, eat solid food, and speak without her voice shaking. Strength returns in small, fragile steps. On the fourth day, Hayes sits beside her during a bandage change and asks the question that has lingered since Greta arrived. How did the wound get that bad? Greta studies the fresh white gauze wrapped around her arm before answering. Her voice is steady at first, but her eyes drift somewhere far away. She explains she was part of a Luftwaffe anti-aircraft unit stationed near a small town. Her job was radio communication, relaying coordinates to gun crews. When American forces broke through the defense line in early April, her unit was ordered to retreat. But the convoy meant to collect them never arrived. They were 23 women and 3 officers, left without transport. The supply truck carrying their medical gear had been destroyed days earlier by a fighter aircraft during a strafing run. With no vehicles and no clear orders, they began walking through the countryside, avoiding main roads and hiding during daylight to escape patrols and aircraft. For 3 days they moved through woods and fields, surviving on little water and almost no food. Exhaustion blurred the edges of everything. On the 3rd day, near a farmhouse, an American patrol spotted them. The officers ordered the women to scatter in different directions. Greta ran toward a nearby barn, heart pounding, lungs burning. She barely made it inside before the explosion came. A mortar shell struck the barn's outer wall. She does not remember the blast itself, only waking on the ground with her ears ringing and blood running down her arm. A shard of shrapnel had torn through her forearm to the bone. She could not feel her fingers at first, only heat and pressure. Another girl from her unit, a radar operator named Ilse, found her among the debris. Ilse tore her own undershirt into strips and wrapped the wound as tightly as she could. There were no bandages, no disinfectant, no painkillers, just cloth and urgency. Then they kept moving. For 2 more days they walked through the woods, drinking from streams and eating nothing. Greta refused to look at her arm. Stopping meant falling behind. Falling behind meant capture or death.